Folks, it is time. I'm your host, BKP. We are at Circuit World in Blue Ridge, Georgia. The sun is shining. Might be a little cold outside, but it is now time for Ask the Doc with Dr. William Whaley, brought to you by Georgia Cancer Specialist, affiliated with Northside Hospital. Dr. Whaley, how are you today?
I'm great. You see the tie, right?
Yeah. I'm thinking.
What's this tie mean? This is my deplorable Neanderthal, clutch your Bible, clutch your gun, Good Friday tie, right? So good. Look at this. Look at Lonnie.
Lonnie, that's a long title on that tie.
Yeah, but we got the first team over here. Lonnie, there's my flag. There's my Bible. Today is Good Friday.
We the people on there.
Right. We the people. I used to have one that had a gun on it, but my wife threw it away. Anyway, so that's the tie.
Can I borrow that tie?
You can, yeah.
Well, I like
you can have the rest of the day if you want it.
Well, I wear one Monday through Thursday on the show. I wear a tie every morning, and I got 2 American flag ties, and I'm ordering a couple more. So
get one with a Bible.
You like that? Yeah, I like that.
If you don't have one with a Bible.
No.
Okay, let's give the weather report.
Oh, you got a weather report.
We had 2.5 rains and hours of rain, inches of rain in an hour, I think, last what was it, Thursday or something. And I've said we've been a little bit down, and we're okay now. And we got 5 days of beautiful sun coming here. God's shining on us on Holy Weekend.
Yes.
And in case you don't know, this is Passover. This is the Holy Week for the Jewish community. This is the Holy Week. We've had Ash Wednesday here back a few weeks. This is Good Friday today, and if people don't know, the Lord was crucified, dead and buried today, and the third day he rose again, and that's going to be on Sunday, and that's all the preaching I'm going to do this morning. Is
that all the preaching you're going to do?
No, I'm going to say glory, hallelujah.
All right, no more preaching.
Right, but this is North Georgia. For God, I have the right to say glory, hallelujah, and amen.
There you go. Okay, hold on there.
Did you know my grandfather was a Baptist preacher?
No, I would have never picked that up.
All right,
now wait a minute. So, our good friend, is he still out on the yacht?
Oh yeah, he's on his yacht. Yeah.
Is he? Okay, Dr. Tidman.
Yeah, he's on.
He didn't name that the SS Minnow, did he? I
don't know. No, because otherwise he'd be aground somewhere today.
All right, Dr. Whaley.
I think it probably says hard work and hard knocks on it or something like that. I hope so.
Before we get to now, you come in this morning and you're all worked up, and you said we have some exciting, some really good COVID update news. So we're going to have that in just a minute.
No, we're going to have that at the end. We're going to do questions first.
That's right. Well, in so many minutes, we're going to have that.
Yeah.
So right now,
in about an hour, maybe.
The all-star panel, if they let you go, I don't care.
All right. There are a couple of words in here. Do you want to try and read it? You want me to
no,
read it?
I don't want to. If it ever comes down to
a couple words here. Lonnie, the words in this one here. This question has words in it.
Let's see. No, I'm not going to try.
All right, go ahead. You get the part for the 17 years old.
You go right ahead.
All right, you ready? My daughter is 17 years old, and she has a heterozygous factor V Leiden deficiency, as do I and my sister. None of us has had any clots or bleeding, and my daughter is scheduled for tonsil surgery. Do we need to be concerned, and what is your long-term advice to her?
Well, first of all, you've got to explain to me. I don't know about those, our viewers out there, but you have to explain to me, first of all, what they have.
Okay. All right. Well, this goes back. You've had this a lot of times. It came at it from different directions, and I'm glad it came this way, because frequently we'll mention this in passing. You remember those ones we've had where people have had the big blood clots in the legs?
Yes.
And the pulmonary embolism, and then they're talking about long-term anticoagulation and that sort of stuff. Remember that? Okay. And then we've said, well, there are causative factors that can be genetic or acquired, and there are causative factors that are environmental, like a long car ride, remember, or you had your ankle broken, They put it in a cast. All right, so show that first picture. Factor V Leiden is one of an inherited group of let's say, enzymes or activities in your body, that's factor V Leiden, that is involved in the cascade of coagulation, which we're going to show something about in a minute because we've talked about it before. But this is talking about the genetics of it. So let's show that first picture. This is a picture. If you look at this picture, this, you got it up there? These people that are half black and half white here? Okay, so here is a male that carries a gene of any type. He's married to a female. Both of them look the same, don't they? That doesn't have that gene, and so these kids are going to get one gene from this parent and one gene from that parent. So you can have any of 4 combinations: none of the genes, or one of each of the genes. So there's 2 generations here. There's the sister and there's a sister and then the mother up at this generation. And then there's a daughter at this generation, and both of them have a single dose of this gene. There's no way that they can ever have children and any of the children have a double dose of the gene. Pull that down, Lonnie. When you've got a half a dose of a gene, you don't get the full impact, and it's not, let's say if it's that gene for the Michael Jordan jump, and you're only going to get half the high jump maybe, okay? If it's a bad thing, then you're only going to get half of the bad thing or even less. Okay, show that next one here. So you've seen this one a whole bunch of times. When they talk about people who have blood clots in their legs, blood clots in their lungs, I think we had one not too long ago who had been riding in a truck for 7 or 8 hours coming from, I don't know, Arizona or somewhere. It was the prolonged car ride. Well, in the general population, the chances that you're going to have some sort of a clot in your lifetime is less than 0.2%. That ain't very much. Almost like the death rate from COVID, isn't it? But any of these acquired deficiencies, it goes up. Now, so you don't care what they are, protein C, protein S. You've heard those before, remember, when we talked about a clot. But here's factor V Leiden. That's greater by 5% greater than the average population, up to 18%. Well, 18% is almost 20, isn't it? Okay, pull that down, Lonnie. So this child and the mother and the sister, if they had any stimulation, let's say a broken ankle or a long plane ride without getting up and walking around, would have a much greater chance of having a clot than the average normal person. That clot could kill you. It can come in your leg and kill you in the lung. Show this next one, because we got to always confuse people. This is the coagulation cascade. So I want you just to imagine that you have just cut yourself. So when you cut yourself, there are 2 pathways to make your blood clot. One that's internal and one that's external. Now, does that look pretty confusing, Lonnie? I want everybody to be confused so that they'll be really impressed when their hematologist talks to them. Pull that thing down because it's so confusing. But this thing right here is the bane of many, many pre-med students' understanding of clotting, and they say, if it's that daggum complicated, I'm going to go to law school or something. I mean, so learning about that will separate the men from the boys. I guess that's not proper anymore, the men from the boys, is it? So it separates the aggressively smart to the rest of them. Okay, so when you go to this next one here, this is these different facts or factors that affect the clotting, like obesity, or having the factor V Leiden, or the inactivity. Pull that down, Lonnie, or the hormones. Now, we all know that they say we don't want to give women estrogen replacement that have got a tendency to clot. One of the things that's on that last thing we looked at, where we were talking about obesity, was inactivity and pregnancy. So the question is, do we need to be concerned? The answer is no, because the tonsillectomy is not associated with any increased incidence of blood clots. If it was a knee operation, just a simple knee scope job, the answer would be yes, but not a tonsillectomy. So no, you don't need to be concerned. Now, what was the rest of the question? Long-term advice. So here's the long-term advice. You got that one up, Lonnie? You got that chart up? It's always got to be a chart. So here's a heterozygote, has not had any surgery, immobility, obesity, is not pregnant. So what's the advice? never give this 17-year-old estrogen containing contraceptives. That's important, right? A 17-year-old girl is going to sooner or later be thinking about birth control. So that's going to be one. Second, tell her that the other things that could stimulate her clotting would be obesity. Maintain a lean body weight. And yes, if you have to have a knee surgery or a big belly operation, take something to prevent you from clotting. And when and if you get pregnant, you probably are going to want to take something during that pregnancy to prevent clotting. So, okay, Lonnie, you can pull that down. So basically, those are just, there's nothing serious in there. There's nothing there that should be scary. Just stay away from estrogen-containing birth control pills, and if you get pregnant, work with your gynecologist on should you be taking an aspirin or something else, and maintain lean and ideal body weight for a lifetime and stay physically active.
Okay.
You like that one?
Yes, I do. Thank you very much. As you know from week after week, Dr. Whaley really puts a lot of research into all the questions to bring you great detail on the answer. So never hesitate to send your questions.
Are you accusing me of building a watch?
No, I didn't.
No, what they say now is ask Dr. Whaley what time it is, and he'll tell you how to build a watch. I don't want to build a watch. I want to tell you what time it is.
Actually, I'm telling them that if they'll send a question, you won't just come out here and give a flip answer 2 or 3 minutes and go play golf.
No, I don't know how to do that.
Right. That's
okay.
Right.
All right.
If they want an answer.
Maybe it's a simple watch. Okay,
right.
go ahead.
Simple watch.
All right, go ahead.
Anyhow, do they make a Timex anymore? I don't even know.
You know, I hope they do, because that was a standard, wasn't it?
Well,
you could run over it, you could drop it in the ocean, you could swim with it, and it cost $8.
All right, so anyhow, I don't know why. You said watch. Don't sidetrack me.
All right, go ahead.
Thank you, Georgia cancer specialist affiliated with Northside Hospital.
Right.
For this segment, we have our second question of the day. Go ahead.
All right, now this doesn't have too many great big words, but it's got some of them. All right, I'm 70 years old and I have prostate cancer. I have had 4 years since surgery. Okay, so now we know that he had localized prostate cancer and it was removed by surgery.
Right.
And my PSA is up. So we know that it wasn't up before because it's now up. And my PCP says I have a spot on my scan. Now, we just went through this a couple of weeks ago about recurrent prostate cancer in multiple locations. So he has a spot. He didn't say multiple spots, did he? The urologist wants me to see a radiologist about gamma knife treatment. You remember that gamma knife is the radiosurgery. You zoom in on a brain lesion just on a tiny thing.
Right.
And you do that in place of surgery. Well, we've talked about it in the brain, right? We've talked about it on lung cancer many times of people who are not a surgical candidate, and you can do that just about as well as you can with surgery. So this gamma knife we've talked about many times before. Talk about gamma knife treatment and a medical oncologist for some shots and pills. What is your advice, and why did this happen all of a sudden after 4 years of negative blood tests? So we know he was followed by his PCP or his urologist. He had no evidence of recurrence. 4 years later, his PSA is rising. They did a scan, and somewhere there's a single spot. He tells us one more thing. My Gleason score was 7, if that is any help. Well, that's a huge help, because you remember most of the prostate cancers we've said before, Gleason 6. Gleason 6 prostate cancer doesn't spread as much. Gleason 7 spreads more frequently, and that's, I think, why they've been following him so closely. So where is that? Put up that first one. So what you're talking about here, this is a concept that's important to remember. This says metastasis-directed therapy for oligo-metastatic disease. Well, oligo means one location, not multiple. And he told us that with a one spot. Right, Bonnie?
One spot.
One spot. Show that next picture. Now, this is a little bit hard to see, but this is the prostate gland down here. So what has happened in most prostate cancers, as we've seen before, is when it spreads, it got into the bloodstream, and the bloodstream dropped it off in multiple bones or multiple lymph nodes and bones, and that's called systemic disease, meaning it's everywhere. On the opposite side, it only dropped it off in one spot. That's oligo-metastatic. Now take that one down, and this will be a lot easier to understand. So if you just look at this is a time frame here. So the patient first had prostate cancer. It was treated by local treatment, probably. He had surgery. Some have surgery plus radiation. He didn't say he didn't have. And now here, this period was 4 years for him. And now he's got a single spot. Well, left without therapy through more period of time, here, see, he's got a whole bunch of spots on this spot. All right, take that down, Lonnie. Got that down? But that's pretty clear to understand, right? It starts out with one spot. This guy does, luckily. Other people start out over here with bunches of spots. Now, we've always got to have a chart like this. All right, you ready? You ready that big old chart? Okay. Non-targeted therapies for metastatic prostate cancer. So these, you can pull that down. I just want everybody to see it's 100 of these. But what he's telling you is that he's going to go to the doctor and get treatment. They're recommending that he get treatment with shots or pills. That's what this is, non-targeted therapy. All right, now you've got to make, what is this definition of oligometastatic prostate cancer? Is it one lesion, or would you say 3 lesions? You know, if you had 3 little spots, would you have 5? Would you say 10? So basically, what does that say? The definition is evolving and may be dependent on what scan he had. Pull that down, Lonnie. So we're going to think that he had the highest degree of scanning. That, you got it down? That's called an axiom PET scan. You've heard about PET scans. Well, this is a specific PET scan that's directed to prostate cancer. So show this last one. You can't ever talk about cancer without seeing these things, right? Always got to have the survival curve. So both of these, that upper level right there is the shots and the pills, with the radiation therapy. And the lower levels, the shots and the pills without the radiation therapy. So clearly you can pull that down, Lonnie. What they are recommending for him gives him an added, that everything between those two lines is added survival and cure. So what they're telling him is, we're still treating your disease like it was localized when you were first diagnosed. We're going to treat it just like we removed it before, but now you're going to be taking, remember, those hormone shots and those other things that are going to decrease the chances that it can recur. So they are giving you the absolute best advice about your prostate cancer, and the reason that it recurred was the Gleason 7, because it was more active at the first. Now, you didn't ask me, but did anybody do anything wrong? And the answer is absolutely not. And did anybody do anything right? And the answer says everybody did something right, because clearly they've been checking you frequently, and your PSA has always been normal. And as soon as it got abnormal, they got all over it like a tick on a June bug. They scanned you. They've decided to give you gamma knife to wherever this spot is, and then to give you one of those non-targeted therapies off that huge chart, which, if they're shots and pills, I can tell you what they are, but I don't want to steal their thunder. So you got the right treatment. There you go.
Folks, thank you very much for your questions. Don't forget, you can send questions to Ask the Doc at info, I-N-F-O, at FetchYourNews.com. You can follow us on social media, anywhere on social media. Send us messages on Ask the Doc, and we will get those questions to him. You can also always watch these segments back and share them with your family and friends. If you go to FYNTV.com, you will find them on Ask the Doc there. Thank you, Georgia Cancer Specialist, affiliated with Northside Hospital, for this segment. So now it's time for you come in, and I've been waiting for this, because earlier when you came in before we started the show, you said you have some really exciting, good COVID news updates.
I know, but I'm like that girl you're dating and taking out to get dinner and everything.
Easy there.
All right. So next, what's this
You're
right
get
here?
us all in trouble. It's Good Friday. Don't get us in
All right.
trouble.
What's all this? This is the news of the week, right?
Right. Yes.
All right. The first thing in the world I want to say is, because we kept talking about the masks and everything, I think Wisconsin's not a pinko state. They used to have a great Republican governor, but just yesterday, Wisconsin Supreme Court strikes down mask mandate. Praise the Lord for Wisconsin. I don't think you should mandate masks in anything. But if you go to, here's where I want to go. Many people show long-term organ damage after COVID. I have been saying repeatedly that. I want the schools open. I want people playing sports. I said the day when we began, we weren't on the air, that canceling a baseball game because one guy had COVID is absolutely stupid. But once you've got COVID and have been sick enough to be hospitalized or take oxygen, now that's not 99% of the COVID. 99% of the COVID is you don't smell too good, you feel good, you go back to school. But if you have been required oxygen or if you have been hospitalized, you have at least a 30% chance of being rehospitalized or getting sick again. But it's 27 times. What's that? 2,700% greater that you will have a follow-up lung disease. 3 to 5 times greater you'll have significant heart disease. 1.5 times that you'll have fatal diabetes. And of the people, now listen to this really carefully, of the people who have been sick enough to require oxygen at home or be hospitalized, now that's the tiniest group of the patients with COVID, 1 in 3 of those people will be readmitted to the hospital. Got that? And of them, 10% will die. And their death certificate will say pulmonary fibrosis, heart disease, uncontrolled diabetes, liver failure or something, and not COVID. So when my bride sends you a text or an email that says COVID deaths overestimated by so-and-so because the death certificate said heart, lung, liver, that's why. They died 6 weeks or 12 weeks after the acute COVID attack from the hanger-on thing. And that's the one thing I'd said about athletes. If you got COVID, you're a baseball player or something, don't go back to playing until somebody's cleared your heart. Now, the last thing is we've always talked, this is Ray, I'm doing this for you. Cancers are being diagnosed at later stages. He says you're not getting enough screening. So this study just was reported yesterday, and this is from Great Britain. So it's going to be a very uniform population. They don't have as many diverse, like Hispanics and stuff as we have. It's a little more educated, a little more socially homogeneous population. Screening tests were down between the start of the COVID virus exactly a year ago, right, March to March, by 73%. And in the last 90 days, as this thing is beginning to open up, the cancers that are diagnosed are at a higher stage. So that delay of 1 year is causing people that have got diagnosed with cancer at a higher stage, meaning later in the disease, like that thing we showed earlier with the oligo-metastatic disease along that timeline.
Right.
You want to get it on the short end of the timeline, not the long end of the timeline. So if you're still staying home, you're not getting your mammogram, you're not getting your colonoscopy, it's time to go get it. Now, you ready for the good news?
Yes,
Because we're getting close to the man, right?
Yes.
What's this right here?
That's COVID-19 testing.
And what's that big blue thing from? Georgia?
Georgia
Department
of Health.
You got
Georgia
that thing up,
Department
Lonnie?
of Health website.
All right, here we go. I want everybody. Is Rick in? Are there people in the green room yet?
Yes.
Green room full? Yeah. All right, I want you to read this out loud now because this is easy to read. This is the percent positive tests reported in the state of Georgia yesterday was
4.4%.
Wait a minute, say it louder.
4.4%.
You remember it's been 14, it's been 15. We haven't had a day on here. We had a couple of days a few weeks ago when it was 9 and 8 and went right back up above 10, remember?
Right.
way back. What's that Napoleon guy's name? That's the doctor that's been on TV for a year.
Fauci.
Oh, is that his name?
Yeah.
Is that his name? Fauci?
Yeah, Fauci.
All right. And that other lady.
Your clues are great.
Okay, the other lady, Dr. Blitz or what? Blitzer,
Yeah, okay, all right.
Blitzer,
Got
Blitzer,
it. Got it.
Blitzer. What did they say? What did they say way back in March? What was the number?
It was under 10.
Five.
Five.
When
Right,
you
five.
reach
Right, under 10.
5%.
This is the go rate. This is go. Open
go.
up.
Let's go.
Right.
10%. Loosen.
Right.
10%.
Right.
We opened up Georgia. 10%. They opened up Texas, Florida. We had, and Georgia. When we opened up. Now wait a minute. Go back and think. We opened up really early, didn't we?
Yes.
We got criticism from everybody. We got criticism from everybody in Washington.
Actually,
D.C.
I think Georgia was the first state, one of the first states. Okay.
Somebody just stole your truck.
Georgia was one of the first states to. Sorry, that's our truck for
That's our
keeping
that's
the
our
light.
moving shade
So
there.
anyhow, Georgia was one of the first states to loosen up, and the criticism was enormous.
And what they say, we were going to have a huge wave of positive tests.
Right.
What's that number again?
4.4.
Now, what's going on up north in New York and all those states that have been like this all the time? They're getting worse, aren't
I think New Jersey, the testing's going up.
Yeah, what are they doing? They're shutting down, getting worse, right?
Yes.
Getting worse. All right. I can't think of any more positive information than that right there. Now, I want to tell you something that bothers me. I said this last week. I'm going to focus on nursing homes first. Nursing home staffs nationwide, in my opinion, should be the highest rate of vaccination because they're working with this most fine of the China, Ray. And their rates are somewhere in the 60-70% range. Other healthcare places are in the range of 50. Now, if you can't get the people that work in a nursing home to take the vaccine, I mean, I just don't know what to tell you. I got people I know really well that haven't had vaccine. I'm not going to go any further than that. But yeah, and you got people coming on. I think the hazard benefit ratio is on the benefit side. Now, Ray sent out a thing last week that if you're a 30-year-old woman, you're pregnant, and you got children at home that are young, it's very reasonable not to take the vaccine, because if you get the COVID, you aren't going to get very sick, and you're still having babies. You don't know what the long-term effects of that is, and nobody has studied that. And if you're in childbearing years and you're worried about your baby, don't take the vaccine. You aren't going to get very sick if you get the COVID. I totally agree. But if you're a TV host and you're gray-headed and you're a few pounds on overweight, I believe that the hazard benefit ratio of taking this vaccine is on your side. And if
we run into anybody like that,
if we do, and if we run into anybody in the green room, if there's anybody in the green room who's 70 or older and a touch on overweight, or 70 and younger and sort of lean and fit looking,
no one's exempt this morning, folks.
No, and if there are people at home watching who are, well, I'm not going to talk about that. But anyway, I'm just telling you.
Leave them alone.
Leave them alone.
We'll take it.
We can't make them change. We can't make them change their behavior. But I am still of the opinion that for people who, you're not having any more children, as best I can tell. And I mean, I don't believe that you're just talking about you.
Okay.
I think it's better. I think the benefit for you outweighs the hazard.
Okay. All right. Point well taken.
All right.
The big news today, trying to come out from under, trying to find somebody, gray hair and all those, I don't know. But the big news today is Georgia's
4.4%.
Positive rate is 4.4%.
Fannin County. Let's bring it local. Fannin County's death rate at this moment I think they added one case in this last week, and that case was dug up. It's something that somebody died, 8 weeks ago or something. So we're really doing a great job in our local community with a much reduced case rate, meaning positive test rate, and much reduced hospitalization rate, and I think a zero death rate for the last few weeks.
Let me say this, and let me ask you this question before we get out. Obviously, if you have a cold and you walk in a room of 10 people, okay, odds are maybe all 10 will get a cold, 8 of them will get a cold, but they get a cold. And then the next week, 10 people recover from the cold. I guess where I'm going with that, and I always have to be careful because, it's not the same. COVID's not the same. But we have situations, let's say Florida, when they talk about spring break. If one person, it's obvious, goes into this crowd and they have COVID, and there's 100 people, odds are that's going to elevate. People are going to get it. And that's just a fact. But the next week, they're going to recover from it. So
they might be taking it back to Indiana and passing it around to more people.
But so we see in some of these things escalating numbers, but then they come back down. I mean, how concerned are you? I think baseball stadiums should be full capacity. I think you should. I think you should sit next to this person. I've
been telling you that all along. I mean, and kids who wrestle, like my grandson, should be able to shake hands after the daggone wrestling match. Here, what you just described actually is sort of community vaccination, isn't it?
Exactly.
So you got a bunch of people who aren't going to get very sick, and they're going to make each other have the virus. Back when we were children, our mothers used to have parties to pass around chicken pox, remember? Because everybody chicken pox was so infectious that if one person in the house had it, then other people said, well, I never had chicken pox, my brother had it. You had it, you just didn't have much of a case. Well, back in the days before we had vaccines, since children had to get chicken pox, when one kid would get chicken pox, all the other parents would bring the kids over to the house so they could get the chicken pox. And they could quit worrying about the chicken pox. They had chicken pox parties in the 1940s and 1950s so that people's children would get chicken pox. Now, that's just community immunization done by mothers back in the day. So I don't know any mothers that are bringing kids to having COVID parties, but basically what you described is a little wrinkle on that, isn't it?
Well, hey, folks, it's April.
It's sunny.
It's sunny.
Get outdoors.
It's baseball season. It's play ball, and it's go to the ballpark, and we'll leave it at that. It's time to go to the ballpark.
Time to go to the ballpark, yeah.
All right. So
we go to church on Sunday.
Absolutely. Sit next to your neighbor. Georgia Cancer Specialist, affiliated with Northside Hospital. We appreciate it so much for the segment. Now, let's not forget, friends, you can always look these segments up. It's real simple, FYNTV.com, FYNTV.com. Look at the top, ask the doc, go there. You can get some information on Dr. Whaley, how to contact him through that. Also get information on Northside Hospital. Find the segments, share them with your family and friends. Okay, we're out.
He is risen.
Yes, indeed. We will see you next week.
Yes,
you have a great Easter Sunday. We'll be back right after these messages with the All-Star Political Panel.